Okay, so I'll just open the syringe. As I said, it's a very small needle. So first we're going to do probably nasolabial folds, because maybe we'll put 1.5 syringe in the lips and only half in these lines here. So if you just take a deep breath in, Snezhana. Yeah, that's good. And just breathe normally now. So very, very slowly I'm just injecting this product. There we go. And smile for me a little bit, please. Okay, and again, breathe in. Okay, just onto this side. No, just a little bit, tilt your hand, please. So as you can see, this line is already gone when I didn't do anything here yet. So I'm now going to work on this side. Okay? Are you comfortable? Everything okay? Alright, so the same thing, you just take a deep breath. So I was just injecting it slightly medial from the line itself, so the product doesn't get pushed away towards the cheek, otherwise it can only make this line look more prominent. So it's very important where it is injected for it to look very natural. Tilt your head a bit more for me, please, and smile for me, and a bit more here. There we go. It sort of get filled in immediately. So these lines, smile for me please, these lines unfortunately they will not completely go away, smile for me, because even if I push quite hard you can still sort of see them. Because today we're only doing 2 syringes, I would like to save a bit of this product to put in the lip to give her a bit of extra volume. Okay? Please have a look, Snezhana, now, if that's enough for these nasolabial folds. I did it up to...
Yes, that's perfect.
Sorry?
That's perfect.
It's perfect. Okay, good. Alright, so we'll do the lips now. In the future, if you want, we can also treat these lines, but as I mentioned, they will not disappear completely.
Yeah. No, I think that's great.
It's enough, yeah. Okay. Okay. And take a deep breath in. Good. Again. Initially I'm just putting a little bit of this Juvederm because it's got lidocaine in it, so it will go numb, so it will be much easier for me to work later on this side. But you can see already that this side is a little bit got the product, so it's a little bit fuller, but it's only a small amount. I have still a whole other syringe to use. Okay, and take a deep breath in. Lovely. Okay. And one more injection here. Breathe in. So the top lip will go sort of quite numb very soon. I'll just do the bottom lip, 2 injections, and then I can use the second syringe. Okay, Danny. Well done. It obviously still hurts a little bit the first time, but I promise you it will be far less painful. Okay, just one more. Great. Okay, can you just please press for me like this with your hand, okay? I still have one more syringe. If you want, you can have a quick look. Where is the mirror? You can remove this. Let me throw it away. Okay, so we just put half a syringe effectively here.
Yeah. Oh, it already looks better.
It already looks better, yeah. It's just bleeding a little bit. Let me just put more. Okay, just press for me like this again. Thank you. To prevent bruising and swelling, we can also use a bit of ice afterwards. But you know, you will not bruise. I don't think so. Here is definitely nothing. And this will stop bleeding in a minute. So how did you find these injections? Was it very painful or?
Honestly, I was expecting 10 times more painful. It was totally fine.
It's good.
I'm
yes,
very pleased.
Okay, and
It's
now
not what
you
I
will
was expecting.
you will feel even less pain because you will start feeling completely numb because of lidocaine, which is in the product.
Okay.
All right. Okay, so I'm just going over the same areas again. Did you feel anything?
No.
Not at all. Okay, good. You can see that it immediately gets fuller. It's very important not just inject into the lips, but actually create a nicer shape, and every person is different, so it depends on their original shape and what they're trying to achieve. Like Snezhana wants a little bit in here, and I can see why. There's virtually like a little bit of tissue missing, so we're just going to put some product here. Watch. Okay. And one more injection here. Okay. I don't think you have any pain now at all because it looks it's completely numb at the moment. Okay. So I think if you have a look in the mirror, please, Snezhana, I think it's enough for the top lip.
Yes.
So I'll put the rest in the bottom one because there should be certain proportions when it comes to lips. The bottom lip should be always a little bit bigger than the top lip. And funny enough, when they talk about beauty, it all comes to having the right proportions apparently. So the same applies to the lips. And you have beautiful lips naturally, but I can understand why you wanted them to have a little bit fuller.
Yeah.
Okay. So, very superficially injecting it. And while I'm pulling the syringe out, I'm injecting. It doesn't have to be exactly the same amount on each side because lips are different and sometimes you need more on one side than on the other. The important thing is just to do that quite quickly before the lips swell up, otherwise it's difficult to judge where to put the product. Looks really nice. Okay. And in your case, I'm happy to put it in what's called vermilion border, which is the border between the actual lip and the skin. So that gives you a little like tanning up of the lips. That's what you wanted to achieve. Initially, in the first few days after the procedure, the lips may look a little bit uneven or a little bit even lumpy, and you will feel where the product is. So don't worry about it. After 1 week, when you massage it, and it's very important to massage it, I'll show you in a minute how to do it, for about 3 or 4 days after that. So just looking now, I would say probably. So when you massage it, you need to do it with clean hands, like this, and you will actually feel initially a bit of firmness there. That's where the product is. Eventually it will disappear and you will have nice and soft lips.
How many minutes do I do that?
You do it for 1 or 2 minutes at a time, but with clean hands, and you do it like 2 or 3 times a day, let's say. Okay.
For a week.
For maybe 5 days or so. When you feel firmness, you still sort of need to do it. I would like you to have a look in the mirror. I still have a little bit left, and I want to know whether you want in any specific areas. Maybe not do it like this, because you would normally not pull faces. So, what do you think?
It's great. I'm just thinking, where can we squeeze?
Well, if you have it enough on the lips, I can certainly put it in these areas here. Remember?
Oh yeah.
Is it enough for the lips? Can you just move the mirror, please? Your lips will look a little bit smaller than they are now, because there is already a bit of swelling. Okay? So if you want this effect, you'll need to finish this syringe. If you think it's better if you don't touch at the moment.
I'm just thinking.
Yeah? I would suggest just to put it in these areas, because your lips look lovely at the moment.
Yes, they do.
I don't think you need any more. It's to have like grotesque lips is not very nice at all. So if you feel that you need more, you can always come back and we use another syringe. But smile for me, please. In these lines, as I said, they will not disappear, but they will be at least a little bit better.
Yeah,
okay, shall we do that?
Yeah.
Yeah, keep smiling like that. I'll stick the needles and you keep smiling. Smile. Oh,